Hello, good morning. Okay. So, well, in this work, we are exploring the feasibility of using a stationary X-ray tomography to detect blood inside brain, especially for detecting hemorrhagic stroke. We're going to show some results according to sampling and resolution properties. So let me first acknowledge all our collaborators. This project or this work is part of a project between the ISTAR lab, of the Johns Hopkins University and the Australian company MicroX. Let me introduce the motivation of the project. So currently, stroke is one of the main causes of death in the US. Approximately 20% of all these strokes occurs with hemorrhagic stroke, affecting around 2 million people every year. So it's very important an early triage, especially if it's possible pre-hospital, to be able to enable an immediate treatment. And in general, that requires medical imaging. For example, in early stages, it's very difficult in a CT imaging to see ischemia in a ischemic stroke. This is acute ischemic stroke, which is after 24 hours. Before 24 hours, it's even more difficult to see ischemia. However, you can appreciate hemorrhagic stroke inside the brain. So a good application for CT imaging is being able to differentiate between ischemic stroke and hemorrhagic stroke, which treatments are completely different. Furthermore, beside stroke, we have all applications of detecting traumatic brain injury occurring with hemorrhage inside the brain as well. So the question is, how can we make systems be able to move the system to the patient instead of moving the patient to the scanner, which is very important for early treatment before they direct to the hospital. So that requires scanners with a small footprint, low weight, so they're high portability, and especially in the case of CT imaging, that presents some challenges because of the mechanical complexity of the gantry, rotation gantry of the CT systems, and also because of the bulky X-ray sources. So we explore in this work a design which is feasible or which is possible thanks to the new advance in technology. For example, the development of non-conventional X-ray sources, as for example, carbon nanotubes, which are considerably smaller than conventional X-ray sources. Also, the use of curved area detector panels, similar to the flat panel detectors using ConvCT, but with a curved surface, is very suitable for this kind of design configuration. And we are going to also explore how can we reduce as much as possible the motion into this system. So let me go to a schematic representation of the system we are going to study. We have some fixed parameters. So we're going to explore configurations with 31 carbon nanotube sources distributed along this arc here, with fixed source to axis and source to detector distance from the central source, and also a fixed total detector area and a fixed fan angle. Let me go from this scheme to something more schematic to make it easier to follow. So we have the U direction of the detector, which is the one with the curvature. For these systems, we are going to have some challenges that we need to address. Some of them are related to angular sampling because we have only 31 sources. So this is going to lead to sparse angular sampling problems. And also for the nature of our design, this is going to have also limited angular problems in which we are not going to be able to have a full angular sampling of the volume. Besides that, we have some mechanical challenges too, as making the system as compact as possible to make it easy to carry it, and also limiting as much as possible the motion of this system. And regarding to other problems, like we are going to have also problems with in-plane sampling challenges, as for some views, we are going to have lateral truncation in which parts of the volume are going to be outside of the projection plane. So to study all of these, we propose a simulation setup in which we are going to show results with using a numerical phantom of a brain, in which we have placed a pattern of bleed inserts of 60 Hounsfield unit of contrast with a diameter of 8 millimeters, placed as every single sphere is located to twice the diameter to the other. We are going to we have a high fidelity simulator, including primary, noise, and scatter in the signal. And this is the parameters we are gonna study for our simulations, for the results we are gonna show you today. Regarding the image reconstruction, we propose the use of penalized weight likelihood, with a quadratic regularizer. We are going to use voxel size of 0.5 millimeter isotropic in the 3 dimension of the volume with 200 iterations. So to study our results or to compare our results, we are going to use several metrics. Some of them are going to be related to the local spatial resolution. For that purpose, we are going to show you a local approximation to the modulated transfer function, in which we are assuming local stationarity and shift invariance. And this MTF is computed through Fourier approximation in local region of interest for different region of interest in the volume, like the anterior, the central, or the posterior region of the brain. And for the quantification, we propose bandwidth intensity, which is basically an integration of this MTF along certain frequencies, and which in this case we are using these frequencies which are suitable for the detection of 4 millimeter already or 8 millimeter diameter spheres, which is the blitz we have. And this is considered in spatial resolution. For noise properties, we are going to show some contrast to noise radiometrics for the different blitz with respect to their background. Also, non-uniformity regions from different region of interest with respect to the center of the brain, and coefficient of variation in different regions in different positions of the volume. So let me go back again to our system and our challenges. I'm going to start talking about the sampling completeness and sparsity. So for that purpose, we study different configurations with different angular span, going from 30 degrees to 160 degrees of coverage of the from the center of the volume. So in that case, what we show is that going to very narrow angular spans or angular coverage is not accurate, because we start losing information in parts of the brain. This can be also appreciated in the MTF. We are going to lose information. We can see these values are lower for the 90 degrees, both for the posterior or for the anterior region of the brain. So we propose going to wider or to more open angular sampling between 100 or 160 degrees. This is more, this depending on which region. For example, for the posterior region, is clearly better going to 160. But in those cases, we start losing information also in the anterior region. So depending on the configuration, we are going to explore different values between 120 and 160. This regarding sampling completeness and sparsity. Let me move now to compactness. So just to remind you, we want system as compact as possible. So we are going to explore different fixed source to detector distance and source to axis distance for the central source. We are going to explore different source radius for the source's arc, and also going from linear to 450 millimeters, and the same for the detector curvature, from total flat panel detector to more compact configurations with a curved detector area. So in those cases, what we saw is that going to compact configuration is not only better because of the mechanical complexity to move the scanner, it's also better in terms of image properties, as we can appreciate here for the MTF, and as well for the image. We can see a better recovery in every region of the brain. So we are gonna use compact configurations around these values for both the radius of the source's arc and the detector curvature. Well, so far we have these configurations with these parameters. So we explore now the feasibility of how much movement or how much we can reduce the movement in the system. So far we have explored totally stationary configurations. So what we're going to explore is if we can improve these images, which in terms of image quality for clinic is still low. So we can explore if we can improve that quality, including one simple rotation of 45 degrees, which is easier than including a total rotation in a gantry system. So for that case, what we saw is the quality of the images after including that rotation is clearly improved for all the regions. And in this case, it's also better going to wider configurations for the angular span because we are recovering better the back of the head, and now we are not losing information in the front. If we go to quantification in these cases, here in the hot map, you can see the contrast to noise ratio for the different bleeds in different regions of the brain. And you can see how for these configurations, we have contrast to noise ratio close to 2 for many spheres for many regions in the brain. And also the properties for the non-uniformity and the coefficient of variance is better for when we include this simple rotation we compare with the total stationary system. So that's why we are going to explore this kind of configurations. So now one question we also had is if for our proposed design, we are going to have worse problems with a scatter than those we have in a normal convexity acquisition. So for that reason, we compare our simulations with the case of a convexity, a normal convexity acquisition. What we saw is that scatter, of course, is going to worsen our images, but it's going to be in a similar way of how scatter is worsening images in convexity configurations. So once we have done all of this and we have achieved to some desirable configuration, we tested our simulations in bench studies. So far we don't have the curve detector. So we were mimicking the curvature of the detector using a flat panel. So for each one of the positions of the sources, we are gonna move the flat panel detector to perpendicular to the tangent of the curvature of the detector. And so for this scenario, we saw that the experimental values in the bench are in a very good agreement with our simulations, especially also we can see here the narrow window for the soft tissue. And if we go to the quantification, again, we see very good agreement between the experimental values and the simulations. So just let me conclude with some highlights. So we have seen that intracranial hemorrhage detection can be achieved with stationary scanners based on multi-source arrays, that with compact design, with the studied parameters, we have achieved a contrast to noise ratio around 0.4 for 60 Hounsfield unit bleeds. And this can be improved to values higher than 1 for contrast to noise ratio and improved non-uniformity as well, including a semi-stationary approach with a single rotation step. And we have also validated our simulation study on bench acquisition with a geometry which is replicating the proposed configuration. Thank you so much for your attention. If you have any question, I will be happy to answer.
It's really interesting work. Thank you. Just a quick question. When you did the rotation by 45 degrees, did your sources line up with the original position, or did they end up being interleaved?
Thank you. It's a good question. Actually, we are rotating the entire system, the sources together with the detector. So, sorry, let me go here. So we are rotating the entire system, the sources together. So the sources are always in the same position with respect to the detector, but the volume itself is fixed. So we are seeing different regions of the volume with each source, for each source, but with respect to the detector, it's going to be the same. So in terms of uniformity sampling, it's going to have good properties, but we're going to see different regions of the brain for the.
But you had 31 sources that were sort of sparse, and then when you rotate, do the majority of them line up, or are they interleaved?
No, they are. We are after the rotation. They don't line up. I mean, they are not intersecting after the rotation.
Interesting design. One question I had is, what about the lesions that are on the periphery, and particularly in the posterior circulation? How does it compare to the ones in the center? Because just looking at for the stationary geometry. So
yeah, that's true. Here, for example, if you compare the lesions here, that's one of the reasons of going to this kind of designs, because for total stationary, these lesions in the back are clearly less appreciated than the ones in the center of the volume, for example, or in the front. But what we saw with this configuration is that more or less, including also the ones in the back, are enough visible so far. So we are still exploring other techniques to improve or to enhance the image quality for our design, to be able to increase these values for the contrast to noise ratio also for the different lessons. Thank you.
Nice talk. Have you thought about the angle of incidence on the detector? Like in some cases, it's very far from perpendicular incidence on the detector. Is there a limit on what the angle of incidence can be? And
You mean the, sorry, this angular, this angle of incidence for the more oblique views?
when the X-rays arrive at the detector, usually you like it to be perpendicular, right? But you can see in some cases the angle is very far from perpendicular. Does that lead to some negative effects? Have you thought about that as a?
That's true. Thank you. That's also one of the things that using curve detector is enhancing a lot with for that, because with curve detector we are going to have some rays which are perpendicular to the curvature of the detector in that position. So, for example, when we went to total linear flat panel configuration, in that cases we saw a worsening of the images, and one of the reasons was exactly that you were talking about. So, yeah, you're right.
What's the limit, you think? How far away from the perpendicular can you go?
Well, that depends on the configurations the total radius you're gonna fix. But for our case, even for the most oblique sources, which in this case, considering the view to the center of the volume, this is 80 degrees with respect to the center of the volume. Still, we had good values with the curve detector configurations.
Okay. Thank you.
Hi, you claimed at the beginning that the system has a smaller footprint than other systems, but you never gave any evidence of that. So there are mobile C-arm CT systems that are very small. And moreover, I don't know if you know the system by Medphoton in Austria. There's the imaging ring, which is basically a ring of the diameter of your blue arc around the patient, and it contains the X-ray detector and one X-ray source, and it calculates basically 360 degrees of data. So there's no data limitation. I guess it has a very similar footprint as your system. So I do not see the point why we should have a system that only has 32 views. And then, since you also found out 32 views might not be sufficient, you start rotating it. So what's the consideration there?
Yep. Thank you for your question. Yeah, it's true that. Sorry, here. Okay, so yeah, it's true that, I mean, in terms of compactness, it is compact enough. What we wanted is a system which was compact enough to be able to transport it in an ambulance. So we did not compare with other systems. That's true. But also one of the improvements here, even including that simple rotation, the mechanical complexity of including one single rotation is lower than a total rotation gantry for our system, which is rotating 360 degrees. So yeah, in this case, we wanted something as static as possible to include the low motion possible we can achieve. But yeah, of course, other approaches like yours is also possible. I
would at least strongly recommend to show pictures of the other system drawn to scale and compare it to this system in order to make it convincing. I believe that this might be a little bit smaller, but I think not more than 10 centimeters or so.
Yeah, that's true. It's not only the size, that's true. It's also the mechanical complexity of the system that we saw. But yes, it's true that I could show other scanners here to make a comparison between them. Thank you.
Thank you.
Thanks.
Right. Interesting talk. It's very interesting that you guys are trying to design, optimize the system. So I was wondering if you ever thought about the other parts of the components, or other components in the chain. For example, data calibration, reconstruction. You show images here. How do you get it? What are the reconstruction approach you're taking? That is a huge variability as well. May help you. So.
Yep. Thank you for the question. Very, very interesting question. The reconstruction we are proposing here, we are using a here. We're using a penalized weight less square algorithm for the reconstruction. And here, for example, it's true that some of the, let me go 1 second to the backup slides.
That's okay.
Okay, so here, it's true that, for example, one of the problems we are facing is related to the truncated artifacts that we are going to see for some of the views. And for that reason, we proposed a modification on the weights to try to minimize that problem that we are going to see from the truncation artifacts in the
Very, very good, because in terms of hardware, you try all kinds of combinations. Maybe algorithm reconstruction part there, maybe other things, you can take a look.
Yeah, thank you so much.
Specific for truncated or missing data problem.
Yeah, yes, true. Thank you so much.
Thank you. Let's thank the speaker again.